I'll certainly give you an overview. I'm certainly happy to answer any questions as well. So, the aorta is the large blood vessel that comes out of the heart and supplies blood flow to the remainder of the body. Um, an aortic dissection is when you get a tear in this large blood vessel, and this can happen in multiple different areas of the aorta. This can happen in the ascending or proximal portion of the aorta where it starts as it comes out of the heart, in the chest, which is a medical emergency, or it can happen further down in the aorta and can be managed differently. Um, it's a very rare syndrome, generally speaking, but it's a medical emergency for sure, depending on the location. Um, and the extent of it. So when we're talking about the frequency of aortic dissection, we're talking, anywhere from 4 to 5 cases for every 100,000 people. So it's rare, but it's certainly a medical emergency when it happens. And it can affect multiple different organs in the body because all the blood vessels that supply blood flow to every organ come off of the aorta. So it can affect the heart itself, it can affect the brain, it can affect the gut, it can affect the kidneys, it can affect everything depending on the extent of that tear, compromising blood flow to different areas of the body. Um, in terms of different things that can influence developing an aortic dissection, there are a lot of different potential risk factors that we look at. One of the biggest things is uncontrolled high blood pressure is a risk factor for developing an aortic dissection. Having underlying atherosclerotic disease in the aorta that's advanced, especially if you have an associated pre-existing aortic aneurysm, it predisposes you to getting a tear or weakening of that wall of the aorta that causes a dissection. There's certain genetic syndromes that can do it, things like Marfan syndrome, and a few other esoteric, more rare things that can influence it. One of the common causes is trauma. That's a whole separate issue. So there are a lot of different things that play into it, but a lot of things that are traditional cardiovascular risk factors also can influence this process as well.
Dr. Patel, can you tell us what symptoms people should watch for so they will know what action to take if they begin having some of these symptoms?
Yeah, certainly. And, symptoms can vary depending on patients, but the most classic symptom for an aortic dissection is severe, kind of acute, abrupt onset chest discomfort. Often people describe this type of chest pain from this tear in the interior wall of the aorta. It's kind of a tearing or ripping sensation or sharp, even knife-like pain that can even go through from the chest into the back is kind of the classic description of this type of chest pain. But any sort of severe chest discomfort, we'd certainly be concerned about that. That's always one of the things we look at as a potential cause. Other associated symptoms depend on how that aortic dissection or tear in the artery is affecting other organs. Some people can have chest pain that's more akin to a heart attack type chest pain, issues with low blood pressure, issues with stroke-like symptoms. So there's a lot of other potential associated symptoms, but the classic initial symptom is usually that abrupt onset chest discomfort.
Right. You mentioned some of the medical history that might make someone more likely to have this condition. And so I was wondering if you could again emphasize who is most at risk for an aortic dissection.
Yep. When you look at traditional risk factors for aortic dissection, it's more common in males. It's more common over the age of 50, especially over the age of 60. So some of it can be related to gender and age, and then long-standing history of high blood pressure. If you've had a prior aortic aneurysm that had maybe been picked up on other imaging they've had through the years, usually we follow this serially to make sure the aneurysm's not growing, because that does predispose you to dissection or even rupture of that aneurysm or the aorta. But high blood pressure, smoking, kind of all the traditional risk factors we think of can influence this. And then there are some genetic syndromes as well. So anybody that has Marfan syndromes, things like Ehlers-Danlos syndrome, are more predisposed to this. And there's actually some family genetic history to certain types of aortic dissection and aortic aneurysm. So if there are multiple family members, especially at a young age, that have issues with aortic aneurysm, there's some genetic testing and things that can be done too, but that's more of a rare scenario.
Got it. We have a question. How are first responders recommended to usually treat patients on the scene when they suspect this, and specifically whether or not CPR is recommended in these situations?
Yeah, it's always hard to make that diagnosis in the field very quickly. If somebody has cardiac arrest, the traditional thing is still the basic life support that you do and advanced cardiac life support, which includes CPR, potentially some medications and things like that. But it's hard for that to be diagnosed acutely in the field. You're kind of responding to what their symptoms are, what their blood pressure is doing, what their heart rate is doing, and that often will dictate kind of the next steps in treatment. And the goal is really stabilization of their hemodynamics, which is their blood pressure and their heart rate, and obviously their vital signs. So that's kind of where the focus is initially. There are different things potentially on the physical exam and things that may clue you in that an aortic dissection is part of the process. But you have to do what's necessary in the moment if somebody's heart's not beating, which includes CPR. But obviously, we worry about trauma in the chest with aortic dissection and things like that. But you have to treat the acute situation.
So timely treatment is critical, it sounds like. Can you reassure folks that treatment is available and in terms of how important rapid care is and how critical timing is when someone arrives at the hospital with symptoms?
Yeah, certainly. So yeah, there's definitely treatment options for aortic dissection when you get to the hospital, and it's all time dependent. The quicker it's diagnosed, the quicker it's treated, especially for a type of aortic dissection we call an ascending aortic dissection, which is in the beginning of the aorta. Time becomes very critical, and it's obviously is often a surgical emergency. So the quicker it's diagnosed, the quicker there's a surgical intervention plays a role in the ability of the patient to survive and recover from that illness. So quick response if you have severe symptoms, calling EMS so that they can get you to the hospital as quick as you can. At Prisma Health, being one of the trauma centers here, we have all the available resources in terms of cardiac surgery and everything to treat the syndrome once it's diagnosed. But quickly calling EMS, quick diagnosis in the emergency department, and quick cardiac surgery consultation are very important.
Got it. Could you tell us a little bit about the arteriosclerotic cardiovascular disease process that leads to this emergency?
Yeah, and like we talked about already a little bit, aortic dissection, there could be a lot of different etiologies or factors that cause an aortic dissection. Certainly, underlying atherosclerotic disease can be part of that. When we talk about atherosclerotic cardiovascular disease, that's more of a general term. That just means, generally speaking, plaque buildup in the arteries and either the heart or any of the vascular beds or blood vessels in the body. And that's usually, the traditional risk factors that cause that plaque buildup are the things you usually think about with heart disease and generally too. High blood pressure, diabetes, smoking, diet, lifestyle issues. And then there's always another bucket of risk factors that are non-modifiable, and that's the genetic component to this. And so the family history part of it. So when we talk about atherosclerotic cardiovascular disease, it's really a larger umbrella of just plaque buildup in blood vessels in the body.
And this is what many people are treated long-term with statin drugs for this, correct?
Yeah, yep. Often, especially when it involves the heart, the statin therapy is kind of a mainstay in terms of trying to reduce your risk of progressive plaque buildup in the heart arteries and potentially other arteries in the body as well. So statins are kind of a main line of treatment. And there's also other options in terms of lipid lowering therapies for people that can't tolerate statins. So we have a lot of options now, thankfully.
Right. Thank you so much. That's a lot of information in a short amount of time. Do any of our media partners have any further questions they'd like to post for Dr. Patel? Thank you for the questions you've given us so far. Okay, well, Dr. Patel, is there anything you would like to, well, here's one more. Let's see. Let's see. I think the question is, how deadly is aortic dissection? And basically, is that something that you assign a survival rate to?
There's a lot of different factors that play into that. It's a good question. The one that carries the highest mortality or potential risk of death with it is what we call an ascending aortic dissection. So in the very proximal section of the aorta, it's more likely to affect the heart. There could be a rupture with it. It can cause issues with bleeding in the chest. So That one is the most time dependent. If the tear in the aorta is further down the aorta, what we call a descending aortic dissection, sometimes that can be managed more conservatively and is less of an acute surgical emergency. So some of it depends on that. And so there's so many factors that play into it. There's not a specific percentage, but every hour in an ascending aortic dissection that it's not repaired, the mortality does go up by a certain percentage. And so time is very important.
Are age and gender factors in how you weigh risk for people?
Not generally. Some of the surgical risk obviously goes up as people age, and so the older you are, the more comorbid medical conditions that you have that will play a role in the risk of surgery itself and potentially the recovery. But there's no absolute cutoff in terms of age that we worry about in terms of mitigating surgery or not having that as an option. But certainly, overall illness, even before that acute event, will play a role in recovery and risk of the surgery.
You mentioned family history as being one of those things. Is this a good topic for families to be aware of as they discuss their overall sort of family health history?
Yeah, I think anytime you get a comprehensive cardiovascular evaluation, or even with your primary care doctor once a year, reviewing family history is certainly important. Overall, like we talked about at the beginning, aortic dissection is a rare syndrome, a very acute one, and carries a lot of considerations with it, but it's fairly rare. But having a good family history also can clue us in into looking for baseline risk and potentially doing other testing from a screening standpoint. So kind of reviewing an in-depth family history is certainly important.
Right. Okay. I don't see any more questions from our media partners. Is there any thing about this condition you'd like to leave us with, Dr. Patel, just in general, how folks can think about this and their family risk and what lifestyle modifications they may think about if they know they have risk factors? What is your advice to us?
Yeah, I think, generally speaking, for cardiovascular health, which also, plays into, aortic issues as well and atherosclerotic disease, is living a healthy lifestyle. It's always difficult with all the time constraints everybody has with family and work and everything else. But diet and exercise modification is kind of the basics of cardiovascular health. And then if you do have diagnoses like hypertension and diabetes, making sure those are optimally controlled. And certainly, smoking cessation is a big part of overall cardiovascular health. So those are kind of the big things. And then if you have symptoms, not ignoring them, making sure that even if they're subtle, making your physicians aware of them. Obviously, the acute, severe symptoms, those are things that prompt you to call EMS and get evaluated immediately. But don't ignore the benign, the earlier symptoms as well. If things just aren't feeling right, it's always a good idea to let your physicians know so they can evaluate things sooner rather than later.
Thank you so much, Dr. Patel. Everyone, this has been Dr. Patel, who's the Section Chief for Interventional Cardiology for Prisma Health Heart and Vascular Institute in the Upstate. We appreciate everybody jumping on so quickly with us today to learn about this. And I'd just like to wish everybody good health. And thank you again for joining us for a quick Zoom briefing on a very timely topic.
All right. Thank y'all.
Take care.